Hi, I'm Dr. Steven Ferguson, have a large medical practice in eastern North Carolina, a little town called Powellsville. We're talking about drug addiction, we're talking about withdrawal, and we're talking about using a product like Suboxone. Now, once you've gone through a Suboxone program and you've weaned down, you've gotten off the narcotics, you're now off the Suboxone, now what do? Well, hopefully along the way you built up some faith, you built up some why you want to be clean. The why is so important. I tell people, what is your why? Your why, we do things for a good why or for a bad why. Why don't you speed through town? You're going to get a ticket. Why don't you go into Walmart and take everything you want out? Well, you know you'll go to jail. So the why is stopping you from doing that. Well, why do we do some pleasurable things? Because we enjoy them. Why do we go scuba diving? Why do we go to the mall and go shopping? Why do we do anything we like to do? Again, it brings a pleasure. So your why for getting clean was to get your life in order, to get your kids back, to get your wife back, to get your mother and parents back, to get your friends back. That was your why. Remember your why after you're done, to get your job back. I've had one of my patients had a great job, making a great income. Okay, he wanted to kind of sneak and do his little stuff while he was in our program. He got fired. He didn't have a high school education, but had a great job. Your why has to be big enough to drive you to do what you're supposed to do. So while you're in the program, hopefully you're building your why, you're building your reason to stay clean, wasting all the money. I've had one patient who was doing $600 a week on his drugs, okay? And I challenged him to save that money after he got out of the program. He had over $20,000 when he got out of the program that he had saved from his narcotics. Now, that's a pretty good chunk of change. Pretty good chunk of change. So I would encourage you that as you go through the program, you're all along the way, you got to get past, can I do it, can I do it? Yes, you can do it. Yes, you can. You got to know that you can. This is where your belief comes in. This is where your why comes in. You know, your why, you might want to spend more times with your kids, your wife, your children. You might not go back to jail again. But your why has to be big enough to get you to do what you said long after the good feeling you had you said was gone. So you can do this. I've had several people finish my program. Yes, you can finish. And yes, when you finish, you're not having withdrawal symptoms. But nobody's going to stop you. Nobody's going to tie your hands together, to zip your mouth together. You still got the ability to do that. And just one last note here. Understand that if you have an addictive behavior, you likely become addicted to something else. So you always have to be on guard, whether it be gambling, whether it be ice cream, whether it be Snickers bars, whether it be oranges. You have a tendency to become addicted to something else. If you got to get up in the middle of the night, 12 o'clock is raining, and drive to the store to get a Snickers bar, you might have an addiction going on. You go to eat your ice cream, you got to have the whole half a gallon, you might have an addiction going on. You have an orange, you got to have 10 of them, you might have an addiction going on. So it could be good or bad, something that you're doing that could be addicting, but understand that addictive personalities kind of flow from one place to another place, so be cautious. As you get off the narcotics, don't replace it with caffeine or soda or smoking or some other bad habit that's also going to be addicting. So I know you can do that. We're happy to work with you in our office right here in Powellsville, 252-332-6484. I know you can do this, and we'll be here to help. Be blessed.